Good afternoon and welcome to today's presentation, Alternatives to Incarceration Today and Tomorrow. My name is Jim Britton and I'm the current president of the Bellingham City Club. The mission of the City Club is to inform, connect, and engage our community to strengthen civic health of our region and to emphasize conversation and listening to others. We begin by acknowledging with humility that the land where we are today is the territory of the people of the Salish Sea. Their presence is imbued in the waterways, shorelines, valleys, and mountains of the traditional homelands of the Salish coastal people, and it has been that way since time immemorial. As always, I'd like to acknowledge and thank our volunteers who've made this program possible. If you know others who couldn't attend today, we're videoing this as we always do, and it will be up on our website and available next week for anyone who would like to see it. I'd also like to thank our sponsors for their support. Peace Health St. Joseph's Medical Center, Bruce and Claudia Deasand, Danny Neal, real estate broker for the Molyack Group, Firehouse Arts and Event Center, Colshan CPAs, the Opportunity Council, Pacific Continental Realty, Unity Care Northwest, Village Books, Western Washington University, Whatcom Community Foundation, and our newest sponsor is the Salish Current. We'd also like to give a big thanks to our caterer today, Good Bowls. For those of you who aren't members and attending, I'd like to encourage you to consider becoming a member. By doing so, you offer support for our ongoing programs, including financial support, and you get a somewhat of financial benefit in that you will be charged $5 less per meeting to attend if you get lunch. Dues are $40, $70 for a household of two, and $10 for those who are under 25. If you're interested in doing that, you can either visit the website or there are applications on each table and you could fill those out. And if you'd like to settle up and pay today, our treasurer, who is in the table to the left as you are leaving, will take care of that. Or if you just leave it on the table, we'll invoice you. Our next meeting will be on July 24th and is particularly timely in this political season. And it is entitled, It's Fake News or Is It? Disrupting Disinformation. Our speaker, psychologist and Western Washington professor Ira Hyman, will explain why we believe information and how we determine what is real and what is not. Also, I'd like to, if you haven't yet done so, please silence your cell phones. And with that, I will introduce one of our moderators for today's presentation, Garrett O'Brien.
Thank you. Good afternoon, everyone. My name is Garrett O'Brien. I joined the City Club Programming Committee. Can everybody hear this okay? I joined the Programming Committee last year, and it's really a wonderful group of people. We've had a lot of fun trying to bring these educational and informative programs to our membership, so thank you for being here. Today's program is focused on alternatives to incarceration and the implementation of the Public Health, Safety, and Justice Tax, which has also been referred to as just the jail tax. There's been a lot of interest in this topic from community members, and a couple of questions have come up. First one was, why is this topic important, and why did we choose this panel? To answer why it's important for us to be talking about alternatives to incarceration, public health and safety and justice, I don't think we need to look too much farther than what's going on in our community to realize that something's broken. hopelessness, addiction. People are living in tents and under tarps. They're talking or screaming to seemingly no one there. These are truly broken lives. Often, these are the people that end up in our criminal justice system and our under-resourced behavioral health programs. And they don't get the restoration and rehabilitation that they need. Sometimes serious crimes are committed, and victims of those crimes deserve justice. And many in our community believe that a safe and humane jail is an important function in our criminal justice system. I believe that we're striving to find the right balance between holding people accountable and providing the services that can restore broken lives. Whatcom County voters approved the public health and safety and justice tax by a wide margin last fall, but they did so based on promises made, not only to build a new jail, but to also address behavioral and supportive housing needs. The goal of this program is to inform the community of the progress that's being made to ensure that these promises are kept and that we can get the best outcomes for our community. We assembled this panel because there are elected leaders and they're experts in their respective fields who are responsible for the implementation of behavioral health programs and the construction of a new jail. After the introductory remarks from our panelists, the programming committee has one question for each panelist, and we've derived these questions from what was called the Whatcom County Justice Project Needs Assessment Implementation Plan, which was about a 120-page document that was presented to voters in June of last year. And we've summarized some of the things that are referred to as projects, and that's on that front and back black and white handout that's on your table. So that's for a reference to kind of give some information on the genesis of the programming committee's questions. Now I'd like to introduce Junga Alexander, who will introduce our panelists and moderate the balance of the discussion. Thank you very much.
Hi everyone, actually my name is Junga Che, and I'm happy to be here with you today. We do have some questions from the programs committee, but there will be time for Q&A from the audience as well. So you'll have your chance to ask your burning questions. And we ask that you keep those as actual questions and not comments. And that will allow everyone to get the fullest benefit out of this time with our esteemed panelists. Also, we're hoping that this is just the first in a series of programs that the City Club can sponsor and host about this topic as we go forward. So this is not the end. Hopefully we'll have more to come. So without too much more time, I'd like to introduce our panelists. There at the end is County Commissioner Satpal Sidhu, who is currently serving his second term as our Whatcom County Executive. He also previously served as a county council member, and he has a vast professional background and experience as an engineer, project manager, business executive, educator, and small business owner. Next, we have Sheriff Tanksley, also known as Tank, who is our current and newly elected sheriff of Whatcom County. And he has over 30 years of experience in law enforcement. He has served prior to this position as chief of Western Washington's campus police, the Portland State University, and also at the city of Blaine. He also has a master's degree in management from Fontbonne University in St. Louis, Missouri. And next is Erica Lautenbach. She is our current director of the Whatcom County Health and Whatcom County Health and Community Services Department, and she started in March of 2020. Previous to that, that was
bad time.
Yeah, or we needed you. Yeah. And she spent time in Washington, D.C., where she spent a year as a American Public Health Association and Brookings Institute Congressional Fellow, and worked for the U.S. Senate Health, Education, Labor, and Pensions Committee. And prior to that, she worked as the Assistant Director to our Whatcom County Health Department. And she has other experience working with a Pacific Northwest group manager for the Recology program, has been a consultant in organizational development for large nonprofits in King County in the Seattle area, and has had experience in policy and health to elected officials on all levels of government. So we'd like to welcome all of these panelists today. So we're going to go in the specific order that was requested by the panel. So we are going to start with Satpal Sidhu.
All right.
The first question to Satpal is, our taxes are being spent on implementing a Justice Project Finance Advisory Board, presumably to oversee the planned projects. That's project number 2. You can see that in the handout. But they don't have the authority to enforce these plans. What oversight with enforcement regarding spending will there be, if any?
Yes. Well, good morning, good afternoon, everybody. Thanks for organizing this forum on this very important subject, because this will be the largest project Whatcom County has taken on in its life. It's to the tune of $150 million, and the council will be borrowing, or the executive's office, we will be, as a county, will be borrowing upward of $100 million bond. And that's a huge commitment, and it's a very serious matter. So, and I take it very, very seriously. The question about Justice Project Finance Advisory Board and their powers, and about the 23-hour relief center, we already have all the funding in place for the 23-hour relief center. So there is nothing that Finance Board has to approve. It will cost us $15 million. We got, first we got $9 million from the state legislature in 2023. Then we, as county, put in $4 million. And then at this last session in 2024, there was a gap of some million dollars, and we received that funding also. So there is nothing that is going to stop us. We already have started the design, and it will be built where the Crisis Stabilization Center is on the Division Street, and it is being in progress so that we have a completion date mid-2026. Thank you.
So the second question for Satpal is, please discuss the status of current jail planning efforts and commitments ensuring mental and behavioral health services that will be hopefully adequately funded and supported by the 2023 jail tax initiative.
Yeah. I reading the questions and things, it gave me a little feel that that in certain minds there is some uncertainty about behavioral health programs and even words used which have been promised. I just want to make it very clear, the whole community, this is not a promise. This is enshrined in the ballot measure. This is not something county executive can decide to do or change or not to do. And this is something council cannot think and decide to change or not to do. So I just want everybody to feel very comfortable that over the life of this levy, now don't hold me to exact number, almost half of the whole levy will be used outside of jail construction or operations. And this is, all this work was done before the ballot. when you voted, you didn't just vote that 2% sales tax levy. The background behind that ballot was the 150-page document, jail project implementation plan. That was actually part of the ballot. So this is not a prerogative for certain council or certain executive to now make that decisions. So all those 15 projects you see, they are law as of today. So I just wanted to assure that yes, promises will be kept, and we starting with the 23-hour relief facility. And one more thing I want to share. The behavioral health services will not be offered only in the jail, because we don't want people to go to jail to get the service. That's totally defeating the whole purpose. We have designed and approved before the ballot that the rest of the money, like I said, half and half or something close to that, is going to create those facilities outside the jail in our community. So I just wanted to clarify this point. Thank you.
I'm not sure that I heard you say that there was going to be oversight of
Yes.
these.
Yes, let me talk about it. There are two bodies. They are also enshrined in the ballot measure. There are two different bodies were formed at the time of the ballot. One is called Justice Project Finance Advisory Board. This consists of mostly the government people, City of Bellingham mayor and county executive, sheriff, small city mayors, and several other officials. They will manage the money part of it, because when the levy comes, the money comes into a fund. How this money gets released from that fund, it's not just county executive just writes a check, say, okay, here you go, do this. So there is a proper process which we go to the council, and this advisory board will be the oversight board for that. There is another body created at the same time. Okay, let me just take it this little, I think it's important. It's called JPOP. It's the Jail Project Oversight Panel, which mostly consists of the community. And they will make sure all the anomalies in our incarceration system and things which were promised are followed. So these bodies, as we speak, actually at the next council meeting, they are seating these people and these two bodies, and then it will start functioning. Thank
Okay.
you.
Sheriff Tanksley, the next question is for you. What are the plans for the work center? And if it is going to be closed, why is it going to be closed? And is there any future plans to have it opened?
Sure. So the plans for the work center is to combine that center with the new jail that we have. With the new jail that we will be building. It really wouldn't make sense to keep the work center open for what we're using it for now if we're going to build a new facility. Also, it's important to have the services in the new facility available for everyone that's in that facility. It doesn't matter if you're there for a low-level crime, if you're there for a violent crime. So at this point, the idea is to combine both centers into one.
But isn't that further away for a lot of people to go to work and come back?
Well, I wouldn't say that it's further away, because our employees live all over the county, and in fact, we have employees that live in Skagit County as well. But I think really when you talk about the economy of scale, when you talk about putting services in one place instead of two different facilities, I think in the long run that is going to improve the services offered.
The next question is for you, Erica. And feel free to also give an overview of some of your existing programs. But our question to you, our specific question to you today is, do best practices and professional guidelines advise that behavioral health is best provided outside of a jail or prison by behavioral health professionals? If so, why? If not, why not?
So I think I know you asked me to go over some of the programs that we have in existence, and I think it's just important to think about this sort of public health approach to incarceration prevention. And a lot of this work has been happening for years, which helped lead up to this ballot measure and allowed us to think about a pathway forward in terms of services provided outside the jail setting. So when we talk about a public health approach, I think we have to talk about that strategy zero. So when there's and I know I'm going to go over 5 minutes. There's 7 items that were asked of me, so this is not going to take 5 minutes, but I'll do my best to be brief. So when we think about a communicable disease outbreak, as an epidemiologist, I look to who is the patient zero, or who is the index case in that situation. And when I think about macro level challenges that we have in our criminal justice system, homelessness, high rates of depression and anxiety among youth, substance use disorder, et cetera, et cetera, et cetera, all the things we continue to chase as a community and as a society. What is the strategy zero? And the strategy zero for all of that is early childhood intervention. So that 0 to 5, addressing adverse childhood experiences. And that's what the Healthy Children's Fund is. That is our strategy zero, is really thinking about how do we prevent the experiences that children have that can change their brain permanently. And it's not a destiny, but it can change their brain permanently that leads them to poor health outcomes. And 77% of women in state and federal prisons have ACEs. Over 50% of men in state and federal penitentiaries have ACEs. ACEs lead to higher rates of suicide, depression, substance use disorder, homelessness, you name it. Adverse childhood experiences, or ACEs, are at the core. They are the strategy zero. So when we think about a public health approach, we have to go much further in the lives of people in order to intervene and really see long-term outcomes. So we have a variety of programs that are sort of hitting people along the range of a continuum where they need services. The first, yes. What is ACEs? Adverse childhood experiences. Yes, ACEs. And so those are things like physical or sexual abuse as a child, neglect, parent incarcerated, so ACEs can perpetuate themselves, right? A parent with substance use, a parent's death, divorce. They're significant. They're significant, stressful, and triggering experiences for children that create toxic stress. So that's kind of the best way to describe them. So we have a variety. So I want to just lay that out. That's really where we need to start. But once people become adults and we have different places where we intervene, the first that we started was mental health court, and that's an 18 to 24 month program that is that's really encompassing. It's supportive. It provides people with really close case management. Our department runs that program for both municipal court in Bellingham and district court at the county. The Ann Deacon Center, which you may know as the Crisis Stabilization Center, which is right by the Work Center on Division Street. That's a 32-bed, 16-bed substance use detox, 16-bed mental health crisis facility that is owned by the county but run by Pioneer Human Services and Compass Health. And they provide those services anywhere from 3 to 5 days. So it's kind of a landing place for people who are in crisis and an opportunity for them to find their next step. The GRACE and LEAD program. I don't know if folks have heard of GRACE or LEAD. GRACE is, and these are acronyms, but just in general, GRACE is for folks who are high utilizers, are highest utilizers of emergency services. So that could be the Peace Health ED, 911 calls, and use of EMS. LEAD is our program for people who are very high utilizers of the jail, and primarily because of drug use, homelessness, and extreme poverty lands them in jail. These are not violent offenders, but continual offenders because of those drivers, right? So we work very closely with them, have really, really good outcomes in terms of diverting EMS calls, jail bookings, and days in jail, really because we're lifting them up in all of the ways that they struggle. 92% of our LEAD clients are homeless when we start working with them. So they have really chaotic lives, and we help them sort of disentangle all of the ways that their lives are challenging for them that put them in that position. The ART program is alternative response. We started that last July. It's an alternative to police response for 911 calls. So we have 2 behavioral health specialists and 1 embedded at dispatch that can help route calls for that behavioral health response when there isn't a need for law enforcement. And they have great outcomes, and they're helping our Bellingham Police Department go to the calls where they're needed. And they take the calls where it might be 45 minutes or an hour, and a police presence is not needed. So really giving people the service that they need at the time they need it with the right response. And then co-responder, which is a great partnership between our 2 departments. We have behavioral health specialists that work directly with our behavioral health deputies in the sheriff's department and provide some of the same services as the ART team, but really give that behavioral health support when that's needed out in the county. And the way station is coming in September. It's on State Street. It's 16 respite beds, so people can leave the hospital and continue to recuperate there, especially folks that are homeless. If they aren't stable and they have a wound, that can become reinfected and land them back in the hospital. So this is a way for them to recover fully. It's also hygiene services, so laundry and showers, and it is Unity Care providing a range of services as well. So this is a partnership between Opportunity Council, Unity Care, Peace Health, and our department. And then lastly, Executive Sadhu talked about the 23-hour crisis facility. We're probably a good 3 years out on that, but it will be at our therapeutic campus where the Ann Deacon Center is, and that will provide people with a place maybe post-overdose, post-jail release, just in crisis, that need a place to kind of regroup and get support. So we're looking forward to that coming online, as well as the way station, but of course there's so much more to do and so much need in our community. So I'll stop there.
Thank you. And
I do want to add something. Yeah. So I really want everyone to know that the Sheriff's Office is working at an unprecedented level with health and community services. I mean, I don't think we've seen the coordination between the 2 departments such as we have in many, many years. I also would like to remind everyone that this is very complex. It's very difficult, and what we're looking at is taking a facility that was built in 1984 and making it fit our standards here in Whatcom County in 2024. And for that reason, the Sheriff's Office, we requested technical assistance from the Department of Justice, National Institute of Corrections. And they are coming to Whatcom County July 15th through the 17th for 3 days to give us technical assistance, not just the Sheriff's Office, but a host of stakeholders here in the community. And I'll just go over a few things that they'll be looking at and helping us with. The facility process. How to better use data to plan the facility, and the functional programming, space programming, of course, staffing and operating cost, site evaluation, action planning, all these different things that we have these experts coming in. In addition, we've taken several trips to different facilities around the country to look at the programs that they have. And I will tell you that I'm a firm believer, and we have witnessed it, that we need behavior care services within the facility readily available within that building. It doesn't necessarily have to be one building. It could be attached somehow. But when a person is booked into jail, we should make a clinical evaluation of how we could best serve that person. So, I mean, it's going to take a lot of work. And I know that there are thousands of people that have great ideas. But there's only so many ideas that we could take and implement. And we will do our best. I was just reading last night that the Vera Institute has a program called Restoring Promise. And that's for 18 to 25-year-olds in correctional facilities, and having a program specifically for that age range to reduce the amount of recidivism, to have programs just for that particular age range so they don't come back to the facility. So I just want to encourage everyone that we are working really hard, but it's going to be a long process bringing a facility that's not functional, that doesn't have the proper programming to the 21st century, and to restore people that come into our facility. And I will tell you, one of the biggest things that we're looking at is how do we give not only behavioral care, but medical treatment to people that are in the facility. I will tell you that if you're on some type of opioids, that you have a 40 times greater chance of overdosing within the first 2 to 4 weeks after being released from an incarceration facility. So we're looking at how to increase those services, how to make it equitable, and really how to get people help. So thank you.
Thanks for that, Sheriff. So I appreciate you speaking on a complex topic, and there's lots of solutions, but we want solutions that we know from studies and from lots of experience that are effective. And maybe there's things that need to be done in the jail, but there's a lot of things that can be done outside of the jail that Ms. Lautenbach has mentioned. And there are guidelines, like from SAMHSA, which is the Substance Abuse and Mental Health Services Administration, that specifically says that individuals get the best care outside of a jail facility. So we appreciate everything that you're doing in your power and in your position, but we also, I think, we're concerned and want to hear about how this initiative is going to fund the effective services for behavioral health and mental health outside. And just back to your answer, you mentioned so many great programs. I think those programs will work, but they need to be funded, and they can't have shortage of workers. So that segues into your last question. Everyone's going to get one more question. And for Ms. Lautenbach, do you know when more behavioral health providers will be hired to fill the workforce shortages in behavioral health services, which is project number 4? Are the funds from the jail tax being used to directly hire more of these providers?
Sure, and I want to briefly answer the first question that you asked, which I didn't because I launched into all the programs and services. And I think while I agree with the SAMHSA recommendation, the more practical answer is behavioral health services are best provided whenever someone needs them. So whether that's the jail or some other institution or out in the community, that's when we need to catch folks, when they're ready to receive them and when they need the services. So yes, technically yes, SAMHSA, but also if people are in jail and need behavioral health services, they should be able to receive them. So to answer your question about this is complicated. We're not hiring behavioral health folks directly necessarily. This is a private industry. So what we have some behavioral health staff, but in terms of growing the behavioral health community in Whatcom County, that's a lot of cajoling, conversation, incentives, trainings, etc., and creating pipelines for students, because they will be hired by private outside organizations like Compass Health, which runs the behavioral health side of the Ann Deacon Center. So our role is really in sort of the diplomacy and making sure that our community has the right level of professionals in lots of different helping areas, whether that's housing providers, mental health providers, human services providers, et cetera. So our role is really in that diplomacy and trying to incentivize folks to locate here, do business here, and provide services here.
Can I add to something to that? I think when we look at different organizations, different recommendations, and what communities should do is all well and good. But the flip side of that is how much money you have in your pocket. We should never lose sight of that. Garrett made a mention that when we look at our community, it looks like something is broken. Very right. But I would say, if we look at our nation, something is broken. It's not Whatcom County is broken. But when we come to, there is a limit to what you all are willing to pay for that. It's not that we have the unlimited money and we are not willing to spend that. This must always be kept in mind by everybody. There are a lot of ideal things that we as a government should do. It's not for Satpal or sheriff, it's anybody in that position. We expect them to do only what they can afford to do. So that's what limits us, that what we should do. And our national priorities are totally out of sync. I'll just stop there.
Can you clarify how much of the funds that is raised by the jail tax that was passed in 2023 is going to be used to hire more behavioral health professionals?
Yes, I can try to attempt to do that. We started collecting tax in April, 2 months ago. And so whatever money is coming in, the other unique thing, which some of people know, some don't know, all the small cities, the way the law is, 40-60, when we take a tax, sales tax, 40% of the money goes to the cities, period. It doesn't even come to us. It goes to the state sends them a check. We get only 60% as a county for this whole project. But all 8 cities, before the ballot, signed and sent a resolution by their councils that we will give up all of our money for first 4 to 6 years to the county. That's a $140 million sacrifice that our cities have done. I want to bring this to everybody's attention. The other thing is, whatever money cities keep after the 4 or 6 years, because we will know the cost of the total jail construction and other programs, and then we will invest that money at that time. If your question is, are you going to hire 4 behavioral health people or 8? I don't know the answer. Second thing is, if I want to hire 4 people, they're not available. You can put an ad in the paper. You can find one. So, yes, we are very cognizant of that, the community's needs, and these programs must be implemented. There is no denial, but it'll take a little time. Thank you.
Wait, we are going to segue into questions from the audience now. Thank you. Thank you, everyone.
Chris?
All right, everyone. And just a reminder again, as was mentioned at the beginning, these are questions. This is not a comment period. This is a question period for them to give us some answers. So we got,
Do you want
well, come on around here.
questions? You want me to do it?
Oh,
We have some logistical challenges here for just a moment. Do you
come
want
on,
to
microphone.
Keep doing,
Okay. We'll
pardon?
let the mayor go first.
Okay. Garrett, why don't you take over? And, okay.
I wasn't, I had my hand raised because I was going to try and give some more specificity to the question that was posed to the county executive. I don't know if people want to hear more details about how the city of Bellingham will be directing their monies. The county executive was right on the ballot initiative for those first 4 to 6 years. 100% of the money was going to go to the capital construction buy down. And after going through and looking at the numbers, that figure will be 75%. So starting this year and moving forward for the first 4 to 6 years, the city of Bellingham will have 25% of their money available to direct towards the Justice Project implementation plan, goals, and strategies, of which behavioral health is one of them. Very broad, those strategies. It includes housing supports, childcare supports, many things. And so it's great news from my perspective that we're going to have money starting in year 1 to support some of those implementation plan strategies and goals. And after we meet the obligation for the buy down and the bond payment to be at the level that we've set in our interlocal agreement, 100% of the city of Bellingham's monies will be going towards the Justice Project implementation plan, goals, and strategies. So I think that's a huge win for our community, and we are actively hiring for a position to support that work in the city. So I just wanted to give that update.
Thank you, Mayor. Garrett.
It's open to questions, so.
Hi, my name is Mary Kay Becker, and I'm asking a question about the data dashboard. And it says that it's going to measure progress toward desired outcomes. My question is reducing the rate of incarceration a desired outcome? And if so, how will that be measured? Will you be able to say, all right, in this year we have so many person days spent behind bars in Whatcom County, and in the following year it dwindled or it grew? And how will that be handled?
Sure.
I mean, I guess I wonder if you think that that is a desired outcome.
Sure. So absolutely, our desired outcome is always, for me, to reduce the amount of incarceration. But in terms of the data dashboard, some of the things that we are looking at is the actual information from, well, the actual information regarding the people that are in jail, how much of that information is actually out there in the public, and how do we collate that information to make it make sense to the public. For example, our index committee for the county, we're looking at different counties and different jails to see what information that they're putting out there. So it's not only the demographic information, but what programs are we offering folks? What programs are folks being entered into for how long? And what's the outcomes of those programs? So we're looking to track data over a number of months and years, not just who's in the jail and who's out. I could tell you currently right now our average daily population is about 326 people in both facilities. Our average our average stay is about 7 days. Right now we have about 18 people incarcerated that's there either for murder or attempted murder We have 26 people in all those categories. But also, one thing that I've been tracking is how many people do we have at the jail that's been there over 365 days? So that's one thing I've been tracking. And right now we have 26. That number is going down each month, and I'm trying to work with the prosecutor's office to ask questions about these different cases to see how we can move those along. So I don't know if everyone knows, but generally a county jail is meant to hold people there that have been sentenced for less than 365 days, although we do have some people there that are awaiting trial. So yes, all the data, we're trying to figure out the best way to collect that and to disseminate it out. So.
If I can just add one more thing, I want to give you all just a glimpse of what we have already, and in the hopes that this will give you some confidence that we're already on this road to the data dashboard and to having good data. We have an informatics team in my department that has been working to try to knit together a lot of different systems that don't generally talk to each other, like the hospital data and the jail data and our sheriff's data and the Bellingham Police Department, et cetera, right? So pulling that information together, we've been able to run the numbers on I'll just say our LEAD program, which is really targeted to people who are involved in the criminal justice system. And I can tell you that using that data, we have found that the LEAD program reduces the number of bookings by 83% among our clients, and it reduces the number of jail days by 92%. So once people are in jail, they are getting out earlier because they have that support and advocacy. And since 2021, this is important too, since 2021, we also look at dollars and cents and cost avoidance. The LEAD program has avoided in cost almost $7.6 million. And it's a number, but what that also represents is suffering diverted as well. Because when people are involved in the criminal justice system, they're suffering and they're not getting the help they need. So we have a lot of data and we have more work to do, but I just want you to know that this ball is rolling and we're really excited to share this publicly so people can see and validate and have transparency around what we're doing and whether or not it's working.
My name is Joy Gilfillan, and I'm going to talk to them because I'm asking them the question, but I'm aware of you. My question is this. When, as the 14-year researcher with the Restorative Community Coalition, we've been studying the real cost of incarceration. And it's way beyond county domination or county systems, because the county is the one that is pointed to as the bureaucracy that has to manage the jail. But the actual cost of taking care of people is way before that, with prevention services, with loss to jobs, to everything. How can we, as a community, convene a group of people to actually talk about money, real money, and how much it's costing all of these people in the room and all the people who are in the jail to perpetuate that system when we can change it?
Thank you, Joy.
The answer is yes. Yeah, and there is a jail operations panel, which is public panel, and people can participate in that. This is not something which is new to us. This is not something unique to Whatcom County. This is our national problem, and it will take to put national resources towards this issue. But we are prepared, we are willing to listen to anybody, and we are willing to listen to good ideas which we can implement within our resources. Yes, we will. Thank you.
Tim?
I wonder if you could speak, all of you, to bail and its role in incarceration, and it seems that nationally there's a growing recognition that bail works directly against anybody who is in a more of a poverty situation, and that you just get stuck. If you don't have bail, you get put in jail, and you may stay in jail because you can't afford bail. So can you comment on how much of a role that's playing in Whatcom County's situation, and what we should and could be doing about it?
Well, the sheriff's office has zero role in determining any type of bail for any individual. Bail is set by a judicial officer of the court. Now, I do know, in fact, that what you said in terms of how bail and bail amounts have affected people in different communities in different ways. I know that particularly just from my family back in St. Louis. But in terms of setting bail and those amounts, the sheriff's office has no play in that at all.
I think this is something that prosecuting attorney and our Supreme Court in Olympia and public, we need to work on this together. But this is very, very valid question that bails should not be a deterrent, should not be used to keep people in the jail. No reason for that. It's very expensive. Hilton, you send them to. And you all pay for that, $200 a day. And we should have no incentive to bring people into jail.
Chris, you want to get around for a few more questions here? Thank you.
Yes, this is a follow-up question to our county executive. You mentioned the problem of hiring people to fill the roles that are desperately needed. And one of the big problems that I see, that I know of personally, is getting licensed in the state if you're from out of state. We have a huge number of people in Whatcom County who are basically immigrants to Whatcom County, namely us. And it's almost impossible to get relicensed in the state of Washington from elsewhere. So we have a dichotomy, a shortage of workers and a lot of people coming in who can't get the jobs because of roadblocks to licensing. Do you have some comment on that? What can we do to fix that?
Yeah, yesterday I was at a retreat for the Northwest Workforce Council and looking at worker shortages and what can we do and everything. You know, our 4-year universities, they are churning out degrees, but when they come in the marketplace, there's very little relationship. We are spending billions of dollars. We incentivize people to go to 4-year college. I'm not against 4-year college. I went there. I got 3 degrees. But this should not be for everybody. We are not tuned to what marketplace is, what universities are doing. Half of the people don't even graduate. The half graduate, half of them don't even match what is in need. We have 5 million jobs today, over $150,000 wages, where they are vacant, and we are issuing 75,000 H-1 visas to other people to come from other countries. We don't want to produce our own, but we will easy to give a visa to somebody come and work in our country and get that $150,000. Like I said, our national priorities are broken. We, as Whatcom County, we can do only so much. We will do. Our promise is that we will do what is in our power. And you're right. We can't find, we have jobs open. We can't find CDH, MCPs, and all the certified people, and we cannot employ. A person can be qualified. We cannot employ because it doesn't have a piece of paper.
We'll go here, and then we'll get to you, sir.
Yes, thank you. So, Erica, I really appreciated you bringing up early childhood strategies. And as we all are aware, one of the issues that impacts that is the lack of quality, affordable childcare. Are there any kinds of things that are happening in the cities and in the county that's going to help with that issue?
Yeah, thanks for the question. So we were allocated, our department was tasked with about $14 million of ARPA funding to provide capital grants to a variety of different childcare providers. And we've made good on that promise, and we've added potentially up to 600 slots of childcare in this community. Some of them are coming online, some of them are already in place as childcare providers build those slots. But it's anything from converting rooms for infant care to supporting home-based childcare facilities to building new buildings with new slots to expanding existing facilities. So there's a lot in the coming years, and certainly the Healthy Children's Fund will add to that number as well. But the ARPA were kind of the go first strategies because that funding expires at the end of this year. So we did a lot to front load the child care component, and we're now building on that foundation to add a lot more child care slots because we know we need about 5,000 more in the next 10 years.
Right here, Chris.
Right here.
Blue shirt.
Oh.
Yeah, I think the panelists know who I am, but I'm Stark Follis, the director of the Whatcom County Public Defender's Office, and my question is for Erica and Sheriff Tanksley. I first heard about the LEAD program probably 7, 8, 9 years ago in Seattle when it was presented to the Defender Initiative by King County, and it was presented as an arrest-initiated diversion program, so a true diversion, where someone had the opportunity to either be sent to the LEAD program or sent to jail or sent to court. And apparently the decision was made in Whatcom County not to implement the LEAD program in that manner. And to my knowledge, it's not significantly being used as an arrest diversion program. With all due respect to your statistics, Erica, we have not seen our numbers change at all in my office as a result of LEAD. I met with the previous sheriff about this, and he seemed to be interested in initiating an arrest-based diversion program, but we haven't seen anything come of it. And as all of the panelists know, caseload standards are about to change for public defenders, and the need to divert people out of this system has never been greater.
And I will add that Stark and I have not met yet about that, but I'm certainly willing to sit down and have a conversation about it. Thank you.
I will just chime in a little bit. Is that our current jail capacity? We have only felons in our jail. We have booking restrictions starting with COVID, and I think everybody is aware of that. We have no place. If we go bring somebody in, we don't have no place to put them in. And all these things are interconnected. The whole criminal justice system need to be looked at. Jail is just one piece of it. Just one piece of it. The whole criminal system, which has evolved over 150 years and is entrenched, is that we need to resolve that. Not that we will attempt to do that as Whatcom County, but I think there are things which are not in the powers of Whatcom County. But you're right. We could do more.
Thank you. Chris, keep going around with questions.
Perfect.
But a few
You
more.
bet.
I'm gonna sneak one in. You guys mentioned a program between the health department and the sheriff's office when you go out on calls. Can you give a little more information about what that looks like and what that coordination between your two agencies is like?
Sure. So with the sheriff's office, we have 2 behavioral health deputies, and those deputies are teamed up with 2 case managers from the health department. I'm sorry, from Health and Community Services. Right. And so they work hand in hand on calls. We've noticed in the last 6 months that sometimes a deputy is not needed at that call. So in that case, the actual provider from Health and Community Services will respond by themselves, and they also have their own transportation. When we first started the program, just for example, if they both had if there was a call, let's say in Kendall, and they rode together, and then the deputy wasn't needed, then if the deputy was driving, the healthcare provider really had to handle that with the deputy being there. So at that point, we decided that it might be best for them to have their own transportation, because if we're not needed, we shouldn't be there. So that program is going really well. One thing that we're working on is ensuring that all our deputies are certified in the 40-hour crisis intervention certification course. Just last week, we had a lieutenant and a sergeant attend that training in Lacey. We are teaming up with the Washington State Criminal Justice Training Commission, to have that course here in Whatcom County. So not only will the deputies on the road be trained in crisis intervention, we could also have every single deputy that's assigned to corrections trained in crisis intervention. So this program is up and running.
If I can just add, agree, it's such a great program. And I had a check-in with one of our new employees, and he was out in the field. And the way it works just practically is those staff will show up in the system for the deputies. So when they respond to a call, they can say, oh, great, okay, Jeremy and Lonnie are working today. I can call them, and I can leave here and go to the next call, and they'll take over. And we're really lucky because Lonnie Bauman, one of our co-responders, is a retired sheriff deputy. So he knows everybody. He's really in tune with how things work in the sheriff's office. And Jeremy's been a great addition. So they really tag team and communicate well with all of the deputies to make sure that the right response happens for folks. And they will sometimes spend an hour, 2 hours getting folks. They were actually at a call for someone who had dementia, and the parent or the husband was asking for some support. Not a police response needed, but they spent 2 hours trying to identify some help and solutions for that family. So that's the kind of thing where deputies need to get back on the road and respond to the emergencies, and the behavioral health staff can really help and make sure that those calls don't keep coming for the same reason, because they're actually solving the problem for that family.
Thank you, guys.
It's great.
I'm going to grab this question for the gentleman up front, and then we'll get a few more in the back.
Yes, Reverend Dr. Mel Hoover. And I was interested because I've had a rare opportunity in that my network in life allowed me to have staff in 50 states and have insight into almost every city and state in terms of the kind of programs that go on. And so one of the things I always ask, and I'm newer to this community, I have been here for a little while, but I was asking as a citizen here, where can I go to see the plan, the blueprint of the game plan that is showing me the place where all of us can survive and thrive? Because there are communities that have those plans. I've helped people create those. I've been trying to find it here, so help me know where I can find it.
Thank you.
Wow. That's a big question.
No, I don't have a quick answer, but I can research and let you know.
We'll take, you got one in the back, okay, and then we'll grab you, and I think that'll be pretty close for questions. Go ahead.
Thank you.
Oh, Dan.
I'm supposed to just keep talking, it'll pick me up. There we go. I'd like to thank you all very much, but I want to return to the data dashboard, which I understand has landed in a better term. I know that it takes a long time to develop staff and collect the data, but do you have any idea of when that data dashboard might go live?
Do you guys get so the question is on the data dashboard, and when's that going to go live?
Yes. Thank you. I just want to bring to the attention that I have a document here which we just presented to the council last week, last council meeting. It has all 15 strategies. We have committed to the council that every quarter we'll update on all these 15 projects listed in the jail implementation plan. We just submitted our first report, and I will send that to Garrett, and you guys can give it to your people. We just received a $275,000 JAG grant to hire a data analyst and to get all the background data. Another thing, the way the systems have developed over time, Sheriff's Department has their own silo of systems. I'll give you a very simple example. If somebody comes into the jail, they have a form. They want name, address, this, and they may have a data they need, they collect that. When the person is in public prosecutor's office, they need to fill their data, they have their own form. They name, address, everything is the same. They may collect the data, what they think is important. Classification, theirs is different, because they have the data for what they need. So what we are trying to do, take that forms away from them. I'm maybe talking very strong here, but of course it is in cooperation, means create one form which has all these data which public needs, other people need, and the executive's office and the council need, so that all this data is collected on everybody, whether the person enters prosecutor's office or sheriff's office or health department. We should have a common database that all these details go there. Then you can pull it. Now, when we go to sheriff's department or you go to prosecuting department, they said, yeah, we have all the data, but they don't talk to each other. You have hodgepodge, a little bit here, hodgepodge here. You cannot make a picture out of that. And that's what, you know why this came out as one of the strategy? Because as IPRTF, the Incarceration Prevention Task Force, and our deliberations as Stakeholder Advisory Committee, this was the first thing people focused on. We don't have data. When can we do that? So we have focused on that this is one of the major duty to collect consistent data about that person in every little department they touch. So that now when we pull it out and then put the dashboard, this will be on the website once we get organized and start collecting the data in a new way. Yes.
So another piece of this is teaming up with a university, hopefully a university here in Bellingham, to have rigorous academic review of the data. So for me, I mean, that's a personal goal of mine and the sheriff's office, to have someone review that data outside of government, if you will. So thank you.
Thank you, guys. I think we got time for one more question.
Hello, I'm Michelle Harmeyer, and I represent the Bellingham Queer Collective, and I'm a retired educator in the K-12 system. We know the Icelandic prevention model, as you may have heard, takes 90% of the resources that America puts into hospitalization, incarceration, and flips that model to say, let's put 90% of our resources into prevention, child development, youth engagement. Can we look at those funds, that 50%, to invest in youth community centers that are third spaces, that are free, that are getting our 12 to 18-year-olds engaged in sports and arts and healthy supervised activities? Because our people in crisis that are 26 years old didn't just decide to fall apart. That started at an early age. So how can we invest in our youth early to prevent this, so that maybe only 10% of our resources go into the interventions?
Yes, I think that's a great suggestion, and and that's where I come to the Healthy Children Fund. When I was on the council, we started talking about Healthy Children Fund at that time, because all the solutions we look around in the different committees and task force and everything is about the back end of the pipeline. When person is already done and everything, and we are investing all the money at that time, what to do with that person. We never look at this pipeline is growing, where it is coming from. That's where they need the investment. It may take 10 years to clean the pipeline, But if you don't stop where it is coming from, it will never stop, no matter how much money you put in. And this is one step was Healthy Children Fund that take care of people at the early age. But you are very right, this was discussed in different formats and different forms. As we develop this plan on the behavioral health side, treatment side, we'll definitely look into this, how we can strengthen our community at a younger age. Whatcom County has right now juveniles, and now this may not be the only reason. We used to have, when I was on the council 2015, we used to have 40 plus people in juvie detention. You know how many we have now? Less than 5. We county, as a county, we invest $1 million more, it's now more than $1 million, which we give it to each school district for behavioral mental health programs. And a couple of times it has come up why we are doing this. This is somebody else's job. Yes, it is somebody else's job, not Whatcom County's taxpayers. But we know this is important to us. And we think that investment has showed up, but it took 10 years. Nobody wants to invest money to see a result in 10 years. Who wants to vote for that? Very few people. They say, put the money in, next day I can get the result. That's what it takes to do that. And I think that's a great example that we are doing with schools, and we can expand that. Thank you. Please stay connected.
Thank you, Paul. One more question here.
Just a yes or no answer. There are many courts on the East Coast where veterans who are charged with crimes are before a judge who has with him or her a series of veteran mentors to work with those who are charged with crimes. Is Whatcom County large enough to have or need any facility like that?
Thank you.
I would say that we're large enough to take a look at any programs that's going to help our community and also help veterans. So I hadn't heard of that program, but I'm definitely interested in learning more about it. I do have one last.
Yeah, please.
So one last announcement from me is that the state legislature and the healthcare authority, they're moving forward with the implementation of the reentry Medicaid waiver program. So they reached out to different counties, actually to different sheriff's offices, to see who was interested in this pilot program. So a few weeks ago, the sheriff's office, we entered our name in that hat and completed that application. So hopefully we'll get approved. So basically the initiative, it allows people that are eligible for Medicaid under Apple Healthcare to receive services in the jail up to 90 days before being released. So as you know, that there's a challenge for us, for people that are incarcerated that has Medicaid, and those benefits stop while they're incarcerated. So yeah, so hopefully, we'll be selected.
This is a really big deal. This is a really, really big deal. And this is part of the reason why jail transitions are so dangerous for people with substance use disorder, because they may have to wait days to have their Medicaid turned back on, and meanwhile they're in withdrawal. And so that's why the lethality post-release is so high. This will be a game changer, and it will also allow community providers that provide services, behavioral health, primary care, to enter the jail and be reimbursed for services, so people have continuity of care from the providers that they know and trust while they're in the jail. It's a big deal, and it's going to change a lot. And we spend over $3 million a year, local dollars, on things that should be Medicaid reimbursable in our jail population. What could we do with that money? It's a big deal.
Yes. One minute. I think it's important information you need to have. Competency restoration means if somebody is charged and says, I'm not, or we determined not able to stand trial, 6 months. Western State Hospital closed. There is no place to send them. We all pay for their stay for 6 months in the jail. This is not something we can do about. We can empty a good portion of our jail, if that is there, and expedite their trial, and find the outcome whichever way this is supposed to be going. And they are in limbo. Their life is in limbo, their family is in limbo, and we as county people are in limbo, what to do with it. This is how broken the system is. And this is not Whatcom County, it's all over the state. Thank you. Thank you for inviting us. Please
Well, I
invite us
have a
again.
question. Hello. One last question. As I sit here and listen to this audience, it's very clear there's a great deal of expertise, experience, and passion in this room. So my question to the panel is, how do we mine that expertise and passion? How can people engage during this process?
One, what I know of is we have Incarceration Prevention Reduction Task Force. They meet almost every 2 weeks, and there's 5 different committees, if I believe correctly. Reach out to them. That is a conduit to outside. Half of the members are community people. We cannot just create new committees, new inputs and things. Use the system we have. If you cannot reach Whatcom County Executive, send me an email, I'll send you to the right person. But use the system we already have. And their only task is to listen to all the suggestions, good ideas from the public, and then form into something which can be implemented. And this is a body we created 5-6 years ago, has been excellent and is working excellent. Make use of it.
Thank you, everybody. And I think we're going to continue to engage at the City Club, too. So this is another forum where you can connect with our leadership, and we can continue to work through this process. I think one of the things that we could really take away from this meeting is that we have people operating in real good faith and working on a really complicated and difficult issue. And we want to get the best outcomes for our community. We're going to continue to work toward that. So thank you, everybody, for coming. And let's give a hand to our panelists. Thank you very much.